animals, human, and the environment that brings us together all have this relationship. And taking one aspect, not dealing with the other aspects, will not help with the health of the nation or health or the global health. So we want to see from the experts, those who have been working on One Health, we want to hear from them what has been their experience, carrying out research, interventional research, putting in interventions, and how can we improve on the transformative agenda for West Africa to ensure health security. All of this, Professor Emikpe would be discussing with us today. And you will hear a bit more about him. So I will hand over to Mr. Deniji to call on the person that will read the citation of Professor Emikpe. Professor Emikpe, we are very grateful and you're welcome. I'm sure your team is with us too. We welcome you all. Thank you very much.
Thank you, Director, for that opening speech. I would like to welcome Dr. A.S. Bakari to read the citation of our lecturer for today.
Good afternoon, everyone.
Good afternoon.
Good afternoon, Dr. Bakari. We can hear you.
A.S. Bakari from the Institute for Advanced Research and Training, College of Medicine, University of Ibadan, Professor Benjamin O. Emikpe.
Professor Emikpe, sorry, please, could you show your face, please? Thank you. Professor Emikpe. Thank you. So, Dr. Bakari, please go.
Can I go on?
Yes, sir. Yes.
Okay. Benjamin O. Emikpe is a professor of Diagnostic and Toxicological Pathology, former chair of the Department of Veterinary Pathology at the University of Ibadan, Nigeria, and visiting professor to Pan-African University of Life and Health Science in Ibadan, University of Developmental Studies, Ghana, Njala University, Sierra Leone, and University of Buea, Cameroon. Currently, he is the Dean of the School of Veterinary Medicine of the Kwame Nkrumah University of Science and Technology, Kumasi, Ghana. He holds a Doctor of Veterinary Medicine, DVM, and MVSc in Diagnostic Pathology, and a PhD in Aquaculture from the University of Ibadan, Nigeria. As a postdoctoral research fellow in aquaculture in Universitas Putra, Malaysia, he conducted immunohistochemical and immunochemical studies on Streptococcus agalactiae infection in red hybrid tilapia, characterizing tissue-specific antigen distribution under heat stress and immune challenge. His doctoral research focused on the pathogenesis, immunopathology, and control of bacterial diseases in fish species, laying the groundwork for novel vaccine strategies in aquaculture. Professor Emikpe's research interests align with One Health, focusing on the diagnosis and control of endemic, emerging, and zoonotic diseases across livestock, wildlife, and aquaculture. His pioneered international vaccination approaches for caprine pneumonia and pathogenic delivery systems for Newcastle disease and infectious bursal disease vaccines in poultry. Since 2012, he has expanded into aquaculture, immunopathology, and vaccine research, emphasizing mucosal immunity and feed-based vaccine formulations. He has successfully mentored and graduated 27 doctoral students in fields spanning animal disease diagnosis, vaccine delivery technologies, probiotics, and phytobiotics, specifically in agriculture. He has graduated. He has also led the first field trial of a field vaccine prototype formulated for immersion and oral delivery against Streptococcus agalactiae in tilapia Malaysian partners. Additional aquaculture contributions include the isolation of Lactobacillus fermentum as a probiotic candidate from indigenous Nigerian food. He has published extensively and has been a plenary speaker at international conferences and workshops on livestock, wildlife disease diagnosis, and One Health. Section editor, Journal of Public Health in Africa, Leone Veterinary Science, associate editor, Leone Biology, that is a severe Frontiers of Veterinary Science as Experimental and Veterinary Diagnostic Pathology section, deputy editor-in-chief, editorial board member, Pan-African Editorial Journal, also One Health, and so on. Others include head, Pangolin Conservation Guild Nigeria Veterinary Team, Governing Council, Precious Cornerstone University PCU, Ibadan, Nigeria, external examiner, pathology undergraduate and postgraduate, University of Nigeria, Nsukka, Nigeria, Ahmadu Bello University, School of Veterinary Medicine, University of Ghana, Niger, and so on. He has won some notable individual and international grants, which include the John D. and Catherine T. MacArthur Foundation, USA, Foreign Affairs International and International Trade, Canada, Co-Scientific Coordinator, German West African Center for Global Health and Pandemic Prevention, DAAD sponsored, AU IBAR, Murefola International Conference Scholarship, University Potential Research Grant Scheme, University of Botany, University of Agriculture, Romania, Erasmus, TWAS Expert, AU Frame Mobility Grants, University of Ibadan Senior Research Grants, and Chairman Scientific Advisory Board, Africa One Health. With this fantastic CV and citation, let me use this opportunity to welcome Professor Emikpe as he takes the podium to present his work. Over to you, Professor Emikpe.
Thank you so much. I think as I listened to it, I was really on board. Coming back home, University of Ibadan is a place that I grew up, and I want to say a very big thank you for this great opportunity for me to be able to speak to my colleagues, friends, people that we grew up together, people that are my seniors, people who are my mentors, and also to my mentees. Let me first appreciate Professor Ajayi Ikeoluwapo and Professor B. Olukasa, the Dean-elect for the School of Veterinary Medicine, for giving me this platform to be able to share one or two things I have done in the area of One Health. Let me quickly say this, that One Health, my journey in One Health was actually born by a grant, a research grant we won in University of Ibadan by the Young Five.
Professor Emikpe, we are not hearing you. Please hold on.
Can you?
We can hear you now, but it's low. And we are not, at times we don't hear you. Can you move closer to the speaker, please?
Can you hear me?
Better and can still be best.
Okay.
Thank you.
I said it's nice coming back home, especially to University of Ibadan, where I grew up and where I became a full professor in 2014. I want to specially appreciate Professor Ajayi Ikeoluwapo and Professor Buea Olugasa, who actually called and wanted me to give this lecture. And I was saying One Health is a field that was introduced to through Mercator grant that we won in 2012. I, with Professor Buea Olugasa, Professor D. Oluwayelu, Professor S.I.B. Cadmos, Professor A.B. Ayimode, and myself. And that led to the establishment of CCPZ, that is the Center for Control of and Prevention of Zoonosis in West Africa. And ever since 2012, I've been working in the area of One Health. Before I moved into Kwame Nkrumah University of Science and Technology to become the dean in 2014 and 2019. And I later bowed out of UI in 2023. So it's once a UI, it is always a UI. And so it's a privilege to come back home to speak to my senior colleagues, to speak to my colleagues, to speak to my mentees and my mentors. It's quite a great privilege, and I did not take it for granted. In the course of this lecture is just to open up a transformative agenda that we might be thinking about as a One Health researcher in West Africa. It's just to open up discussions. It's not exhaustive in itself, but it's just for us to have an understanding that we have a lot to do, and our research must be a kind of transformation agenda that must be transformative, translational, and must be able to be policy driven. So in the course of this lecture, please, if I did not mention your aspect, it is not intentional. It is just for us to have a discussion together and see how we march forward with the principles of One Health and to work in the area of One Health research to bring up the new changes we expect in West Africa.
Sir, please increase the volume. People are still finding it difficult to hear you. Could you move closer to your speaker?
I'll move closer now.
Yeah, it's better now, but it has to be consistent. Thank you.
Okay, no problem. It will be consistent now because it's with me. Please, can we just start? The title is purely exploring. We are exploring One Health research for a transformative agenda for West Africa. Next slide. This is the outline of my work. This is the outline where we talk about One Health concept. We look at zoonotic disease burden in West Africa. We critically look at West Africa ecological and sociological peculiarities. Then we delve into indigenous knowledge and the need for us to develop this into scientific-driven evidence. The key areas of zoonotic disease control in West Africa, strategic approaches for transformational agenda in West Africa, and collective effort for collective impact in West Africa. As a matter of introduction, One Health concept clearly show the interconnectedness of both of animal, human, and environmental health, which is extremely vital now, not only for health security, but for sustainable development in West African sub-region. One Health research also combine human medicine, veterinary science, environmental science, social science to tackle complex issues, complex challenges that pandemic brings to West Africa. If we look clearly at research, it's a systematic investigation to establish facts, to bring out evidence, develop new knowledge, and more importantly, to solve problems. In One Health space, our research must inform evidence-based interventions, policy-driven evidence, surveillance, innovations that has to do with health system at these interfaces. In West Africa, where the burden of zoonotic diseases is high, pastoralist lifestyle is there, very prominent. Our research in terms of One Health will really make a lot of impact. For One Health, therefore, research to be truly transformational, we require serious rethinking of our priorities. We must also bring us structural reforms, deliberate and intentional institutional collaboration, purposeful youthful engagement to bring new crop of leaders, an alignment with solid technological innovation that is quick and sound in their approach. Plus, for us to make animal impact, veterinary medicine, comparative medicine, human medicine must be able to work together. For us to make human impact, we must improve our health and global security. Then we must integrate social science deliberately, appreciating the need for agriculture
How are you?
and engineering. We must purposefully look at environmental impact, work together with zoologists, with biologists, ecosystem science, art science, geoscience. We must all come together to work together in the space of One Health. One Health is no more one medicine and one world. It's not just human medicine, veterinary medicine. It has to do with social science, agricultural engineering, AI, different ecosystem, geographic information system, analytics, data science are all coming together to work in the space of One Health. Let's look at the overview of the burden of zoonotic diseases in West Africa. West Africa is globally recognized as a hotspot for zoonotic disease, largely because of the convergence of both environmental, socio-cultural, economic, and ecological factors. If we look at zoonotic diseases clearly, it's a transmissible disease between animals and humans. And many times in Africa, in West Africa, there's emerging and reimagined infectious diseases, just like we have these infectious diseases since 2012, 2003. You can see that virtually every year, the world is bedeviled with various infectious diseases, pandemic diseases that claims life, not just in Africa, but all over the world. Specifically in West Africa, you can see Ebola, Marburg in 2012, Lassa fever in 2009, Lassa fever in Ghana 2011, in Benin 2014, in Togo 2016, dengue. Quite a lot of diseases have really taken West Africa as a place to stay. What are then researchers doing in this space? Why is West Africa a hub of all this? Number one, ecological factors. We are full of a lot of high biodiversity, especially wildlife reservoirs that involves rodents, bats, monkeys, and the tropical climate also favor vector-borne disease transmission. And that tells us that climate change is a very serious issue that will change the concept of vector-borne diseases transmission in West Africa. Frequent deforestation, land use change, and increased human-wildlife contact, and that has brought in diseases that is of pandemic importance. What then about our socio-cultural and economic factors? And I will be looking at socio-cultural factors more in this discourse. The traditional hunting and bushmeat consumption. We love our bushmeat. Grass cutter in Ghana. Informal livestock trade, which is poorly regulated, and poorly regulated slaughter practices. Cross-border livestock migration, pastoralism, they move without any plan. Urbanization without commensurate infrastructure. Let's look at our own health system. Our health system is sort of fragmented with very low priority given to human and animal environment surveillance. Our diagnostic capacity is extremely inadequate. Then when we talk about data sharing amidst sectors, it's highly limited. In terms of biodiversity, we can see in West Africa, we have all the bats, the animals that are the transmission source, and we can see the array of diseases: Ebola, Lassa, anthrax, rabies, brucellosis, that causes undulating fever, zoonotic tuberculosis, Rift Valley fever, leptospirosis, mpox. Why? Because all their transmission sources are bound in West Africa. And we can see the countries that have suffered these zoonotic diseases based on the presence of this transmission source. The main drivers of pandemics are hitting big in West Africa. Climate change, the wildlife habitat encroachment that lead to spillover pathogens from the wild to humans, extensive agriculture, and human mobility. They are making pandemics to be in West Africa every year. Different types. If it's not Marburg, it will be monkeypox. If it's not monkeypox, it will be Ebola. If it's not Ebola, it will be zoonotic tuberculosis. We have had experience of mpox, Marburg, avian influenza, swine influenza, rabies, anthrax, brucellosis, tuberculosis, toxoplasmosis, trypanosomiasis. We have done all this research. Beautiful papers. Many professors, more than 600 in University of Ibadan, everywhere. What some of us have decided to focus on less focused areas: Acobacter, Helicobacter infection, cross-species transmission of avian influenza at the border places, antibiotic residues and resistance, climate change, heavy metal pollution in selected organs of Africa, of African animals that are termed to be chemical zoonosis. What about preference? How has preference changed a lot? Consumer preference and the preponderance of zoonotic diseases. What about pneumonia-inducing zoonosis? We've done a lot of work. But the question now is, has our research informed policy? Is there any translation of our surveillance data into actionable, cost-effective policy interventions? As our surveillance of most outbreak responses given a long-term policy reforms? As our peer review publication, over 500,000, as those studies have they been taken by policy uptake? Have they been utilized at all? Our community engagement, town-to-gun interventions, town-to-gun relationship is extremely weak. What then is our link of our research to long-term policy decisions? This is poorly structured and highly undocumented. How many of our legislators can talk about informed policies or can talk about our researches and tell how it has influenced the life of the grassroots people? We must then have a paradigm shift where our research must focus to solve problem. We identify the problem, we explore, we select the best ideas, We push and test those ideas, evaluate the ideas, and make sure that we solve the problem in West Africa. Let me take us through a few things. What are those researches that we have that grassroots touch that people will be able to appreciate? Yes, research into cultural practices that promote zoonosis. What are the method of our killing of our grass cutter? Here in Ghana, we have seen grass cutter being laden with crocodile bile. And when they use it, they kill the grass cutter. We eat the grass cutter. What's the implication? What is the implication of we adding the stomach content of grass cutter to our soup before we say it is tasty? What about the implication of killing animals with guns? It has led to lead poisoning. People have started having kidney problem and liver problem. What about our butchers and meat sellers that does not even understand what tobacco is, and they take it and put it in their mouth and call it egusi? What about the unhygienic practices where you dust your hand like this and you think the hand is clean to eat, and that will promote antimicrobial resistance? What is the research in terms of hunters and hunting dogs? How does this spread rabies? It is when we have these evidences we can start to change the cultural practices. What about the indiscriminate slaughtering of dogs in Buea in Cameroon, in Butatanga in Ghana, in Cross River, Calabar in Nigeria? What is the implication of that to spread of rabies? What is the implication of killing donkeys, using their height, using the heights of animals in the propagation of brucellosis? And that is why brucellosis is called Buea disease, because they have seen the relationship. How far have we walked on this area? There are things researchers has to take. Let's look at this dog, this pig. This is a pig that was reported to show rabies, classic rabies in pigs. Foaming. This was reported to one of my very great scientists in KNUST, the chairman who has been working on rabies. This was reported to him. Alas, what did we do? The meat from this animal, before it got there, was already roasted and eaten. Rabid pork meat being consumed. The attitude and behavior of our people to rabies. It will shock all of us. When I asked them, why did you take rabid dog, rabid animal? They said it's good. When you eat rabid animal, you see spirit. You will be energized in the spiritual realm to see spiritual beings. That is how far the local people have known. I've gotten to Butatanga where they show me concussion. That if you use this concussion to cook anthrax infected animal, the anthrax will go. They will eat it well. And they believe so much in it. What evidence do we have to change the cultural look of our people? This, either we like it or not. This is us. This is One Health. This is our environment where we all sit together to eat. Our house is here. You can see duck, many animals. These are farm. This is purely Africa. We started One Health. One Health is part of our living. We get our food here. We feed our dogs. They protect us. We live together. And this type of interaction, how does it help in promoting zoonosis? Who has documented it? None. These are things we need to do. Let's start from ourselves. Let's start to think about native intelligence, which is a community approach of intelligence gathering, not using laboratory, but using the people. Participatory epidemiology has been used by Munga et al. To unravel River Valley control. The involvement of district head, chiefs, market women, hunters, association, established health institution in the rural setting, the traditional healers, the birth attendants, the community health and animal health officers, food vendor, water carriers, palm wine sellers, farmers. This is when we will be able to know what happened at the grassroots, community-based intelligence gathering, and we look for solution by intercepting few things, putting standard, and the problem will be solved. What does West Africa has? West Africa has indigenous knowledge that saved us during COVID. If we did not use our ginger and all the things we have, all of us will have died. Those are antioxidants. It is after finishing we know, but we have the indigenous knowledge. Where are they? These are collective issues that has been tested over years. How many of us are researching into it? All what we do is genomics. I'm not saying genomics is not good, but we have something we are proud of. White people have been proud of their work. Jenner was the son of a farmer. He looked at what his father was doing. He saw the relationship between cowpox and smallpox and was able to design the smallpox vaccine. Vico was the son of a butcher who was looking at the state redness, pain associated with inflammation. Is the one that described inflammation. If we think our native intelligence does not have anything to gather to provide for us, I'm saying it here, it has a lot. Because most of the fundamentals of science that we are describing today start with this native intelligence. Pastoralism has come to stay in West Africa. It is part of us. Can we turn it around? Even though it spreads diseases, it shows that it's our long-standing livestock system with economic value. Our transformation agenda must then embrace innovations that bring animal tracking technology, predictive health models using artificial intelligence, mobile veterinary health services, harnessing pastoralism for surveillance healthcare delivery system, where we bring in one health clinic, one health hospital. In Niger, it was when they tag human vaccination with animal vaccination, that was when they had an enhancement. We should now be thinking of one health hospital, where facilities are used both for animals and humans. That will save cost. Let's look at institutional landscape and capacity gaps. One of the major barriers to effective One Health implementation in West Africa is institutional imbalance and fragmentation. A, disparity in the spread of academic programs. Medical school existed in every West African country. Veterinary school, concentrated only in Nigeria, Ghana, and Senegal. The other countries, they don't have vet school. Environmental science programs are more present in those schools, in those universities where there is no vet, in those countries where there is no vet, but are more often disconnected from veterinary and human health. What then is the consequence of that disparity? It causes unequal distribution, weaken interdisciplinary collaboration. And that is why environmental officers can then stand that they are veterinarians to manage abattoir, sidelining animal health perspective in critical food safety and zoonotic control environment. Where did we drop our mapping? Mapping as a tool for reforms. When I did this map, it gives me an overlay of medical school, veterinary faculty, environmental institution, and One Health centers. This mapping alone of this institution can clearly show to us the training gaps. It will also tell us the need for us to collaborate and guide our policy investment in undeserved area. You can see all this. The best of the school, yes. Veterinary school, county 13 in Nigeria. Medical school, plenty in Nigeria. Benin, only medical school. Togo, medical school. In Ghana, 2 veterinary schools, many medical schools. Cote d'Ivoire, only school that did environmental science. Guinea, you can see how it's spread. Mauritania, none. Mali, 1. Niger, 1. Burkina Faso, how many? None. And every one of us sit down in Nigeria How can West Africa grow when the schools are only concentrated in Senegal, in Ghana, and Nigeria? All other countries, there must be an intentional move, either by people trained here to develop others in other nations, to make West Africa agenda something that we need to look at. There must be an overhaul of our curriculum. We need to start to incorporate artificial intelligence, predictive analytics, and data modeling. Promote interdisciplinary training in medicine, veterinary science, and environmental health. Engage in joint degree, MBBS, MPH, DVM, MPH. Flexible models. Start thinking of language track. Can we incorporate French? That is why in Buea, everyone in Buea can speak French. Are our candidate prepared for international assignment? No. Our candidate prepared to hold international that will divert and move grants to our country? No. And that is why we are struggling, because the people at the end of affairs, we have not trained our younger ones to take over. We need to start to empower our young leaders. Young scientists, professionals must be trained not just to conduct research, but should be leaders of change in West Africa. We must also know what is the strength of West Africa. One of it is traditional medicine. We need to develop our traditional medicine, just like the Koreans have done, just like the Japanese have done, just like the Chinese have done, promoting it. We even have a Chinese journal for native medicine because they have developed it and have evidence base to prove. We must also work intentionally on our environmental degradation. See it as an opportunity to think of ecological remediation strategy, green jobs and restoration technology, community-based adaptation and resilience building, so that we see this not just as a problem, but as an opportunity for development, turning crisis into economic opportunities. We must also look at the issue of antimicrobial resistance, where there is misuse or poor regulation of veterinary drugs, inadequate diagnostic infrastructure that has led us to inappropriate use of antimicrobial, especially more in veterinary practice. This has shown to us that there is lack of one head-based AMR surveillance system that integrates animal and human environmental. No doubt we have tried. I'm not saying we have not done anything. Only on paper, National Action Plan on AMR in countries like Nigeria, Ghana, Sierra Leone. They have established one Earth AMR coordinating platform. FAO have assisted us to educate farmers and leaders, sellers. Pilot implementation program had been done. But how far has this one led us? Paper, no action, because it's not driven by policy. Then we must intentionally work on antimicrobial stewardship program. Strengthen our regulation and governance by moving to inform policy, bringing alternatives. God has so much blessed us. We have all these traditional medicine. We have plant, we have phytobiotics, probiotics. We have developed this in fish. We have developed this in many things. Let's incorporate it into our livestock. Let's improve our diagnostics and surveillance by producing local-made kits. It's not that we don't have the knowledge. We have. Let us now focus not on papers but patents, so that we can invite industries and start to work with them. Think of environmental control, behavioral change. Let sociologists work with vets, human doctors to bring out awareness and behavioral change. This is what we call innovation, integration of our indigenous practice. Why I'm saying a lot about indigenous practice is this. Please, let's say it. If you come and talk about my culture, I will listen to you. When whatever solution you are bringing in does not involve my culture, I will never listen to you. And that takes me to talk about a particular program where they have done so much, provided water for the community. And deliberately, the parents were spoiling the bowl. And they brought in a sociologist. Why are you spoiling the bowl? They said, look, our children used to go for about 30 minutes, 1 hour. Our house is just one room. When will I have time to have sex with my wife? So I encourage the children to go to fetch water from the river, spend 30 minutes and 1 hour early in the morning. That's when I meet with my wife. And that was when such a problem was solved. Because they never think of the social aspect, that they only have a room and you are providing water for them. It didn't work. There must be an integration of the socio-cultural issues for us to make impact in West Africa. Our disease surveillance and early warning system is fragmented. There is weak integration of data into national disease surveillance. Our outbreak detection and reporting is extremely poor. This I have seen, and it is use of our digital tools, even to collect data and to forecast. How many of us do we know how to use these tools? I will say, yes, we have the IDSR, Integrated Disease Surveillance Response Strategy. Everything is strategy. We have even created platforms. We have developed SOMAS for Nigeria and Liberia. How far has that informed policy? We have improved laboratory networking, data sharing platform, WHO, CDC, Africa, using One Health approach. How far has this translated to a change in West Africa? If policy, budgetary allocation, economic importance is not stressed in our research, what then do we need to do? Develop tools for early warning system that has roots in our own socio-cultural issues. Develop quick diagnostic technique that is eco-friendly, cheap for resource-limited setting. Dashboard and analytics for prevention. This is what Ethiopia did. It's not that they have so much money, but they are very good in mathematics and algebra, and they use that to develop the statistical things in whatever they do. You establish community-level surveillance and risk reporting in a simple manner. Hey, mining and environmental degradation. This is a problem throughout West Africa and throughout Africa. Because the legal and the illegal mining activity are degrading and polluting water. Estate development is replacing green places. Heavy metal contamination is happening everywhere with mercury, arsenic, and lead. People are having liver problem. The water quality is bad. The kidney dysfunction is linked to environmental toxin. There is no ecological health assessment study, land use change monitoring. The quality of our water, how it goes every year in the last 10 years, we don't know. Pollution mapping has not been done. These, if they have been done, where are they? Does it inform policy? Have we spoken about it? No. It's not just speaking about it, involving the people to make the change possible. Let me play this so that every one of us will listen.
In the next 20 years, if we don't stop this illegal mining, Ghana, we will import water to drink. Yet we don't care. And Chinese, they will come from their country into our forest, destroy our forest, destroy our land, and illegally mine and damage our waters. How can they come if the traditional leaders didn't give them permission to do that? And in one instance, while they were there, our military went there to protect them. Our own military that is supposed to protect us, rather protected than foreigners. It destroyed our water and destroyed our forests. The enemy is not outside, the enemy is within.
The enemy is indeed within. You can see how far they have gone in West Africa. These are the mining activity, gold mines. Look at South Africa, everywhere in Africa. Look at it in West Africa. It's increasing every day. Look at the water we drink. This is the data that he's talking about. You can see the pollution, the level of pollution. Who cares? And this is what we face every day. If something is not done about mining, about looking at the major issues we have in West Africa, I don't know how we are even going to fare. Education and capacity development. Imbalance in academic institutions offering training of veterinary, medical, and environment. Curriculum gap. Focus should be on One Health, AMR, digital epidemiology, predictive modeling, underrepresentation of veterinarians. In fact, it is now that I've seen from the map and all that the problem of West Africa is not medical education. It's not environmental education. It has to do with veterinary. The only university that offer veterinary medicine are in Ghana, in Senegal, and in Nigeria. And that is why the One Health driven move is very, 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 very slow. So we need to think in developing specifically veterinary medicine. We have developed curriculum that deals with One Health in KNUST, Ahmadu Bello University, and also Sheikh Anta Diop University in Senegal. FAO has assisted Elizabeth. In fact, FELTIP is working very well in Nigeria. How far? What is the integration of One Health concept into MPH, into DVM curriculum in select university? Is there any youth and early career network like Africa One is promoting cross-disciplinary leadership in One Health? Not only within the Anglophone, but within the Franco and the Anglophone, which is extremely important in West Africa. Look at veterinary school in Nigeria. Look at it in Ghana and Senegal. That is one major problem. We have 11 schools in Nigeria, if not 13. There are 3 schools in Cameroon now. And Sierra Leone has no veterinary school. And what do they have? Weak One Health approach. Veterinary contribution to One Health is extremely important, not only in the prevention and control of zoonosis, but to ensure food safety and security, protect public health through surveillance and monitoring, support conservational effort, especially to make sure that wildlife population are safe, and also to develop comparative medicine research to benefit humans so that our ability to forecast will be a lot easier. Not using human beings as guinea pig, but we can use animals and use whatever we get there to project what will happen to humans. Now to area of research and innovation. Most zoonotic researches in Africa lack policy relevance, economic analysis, and real-world applicability. One legislator asked me, how much will I use to control this disease? In simple terms, just do some calculation and tell me. I cannot. Because we don't really know the importance, how much we need, and we don't even have what can give them enough evidence to incorporate into the budget. So they don't know what to do. And there is limited investment in indigenous knowledge and traditional medicine research. Our collaboration amidst researchers, if I ask, how many people have friends in Senegal, in Niger? I got all these friends when I joined Africa One, when I became the chairman of the advisory board. I was never trained to have friends in French-speaking areas. Now I have students in the Republic of Benin, students from Togo, through Africa One. So there must be a deliberate effort to link ourselves together, to work together, both not only through sectoral, but also through lingua. Few platforms for data sharing and predictive modeling. We know we have done so much. There are centers like WASIM, GWAC, CCPZ, WAVES. We have been working on multi-country research on COVID-19, Mpox, growing number of researches validating traditional medicine. How many did I see like a tablet? How many have been incorporated into the health system? It's only Ghana, where they train ABBA doctors in KNUST, where they are producing ABBA medicine that is being incorporated into the primary healthcare system. Initiatives such as React Africa, SADIS are promoting innovation in AMR, but how far has it gotten to the grassroots? Look at the center. MVRI, GIS, Noguchi, KCCR. How many of our interaction projects has brought all of us together to think about West Africa? None. Everybody wants North-South collaboration, not South-South, not intra-West Africa collaboration. We need to give this. We must also think of AI. AI is moving fast. Not AI just for distribution of vaccine, but for misinformation mitigation. Because the problem of many pandemics is misinformation. We have good success story in COVID. We have used our plant-based solution to solve a lot of problems. And we have seen that it has antioxidant. It has helped us boost our immunity against COVID. So the opportunity to explore in West Africa is now to think of efficacy of herbal remedies. Save integration of this into our health system. Because these are things we can produce ourselves. We know them. We can do them. And we have done a lot of research on them. Let us make it to work. Involve it into our health system by doing a bioprospecting and drug discovery. Do we have any center on zoo therapy, on traditional medicine? If I say, oh, we need the head of pangolin, there are places where we can do mapping to know where all these things are moving. And we can use this. Many of them are being used for medicinal purposes. How do we trade them? Do we link this even to pandemics? No. The research is needed to document species used and their conservation status. Regulatory framework must be established. Can we have forensic screening using molecular tools, use of AI and GIS to track trade and use pattern of some of these products so that we'll be able to educate our people and the fact that some of these products can spread zoonosis. Traditional knowledge with science will inform policy making. When we talk about policy and governance, we know we have weak political will to integrate this into national health strategy. Let's move on at policy from theory to operational framework. Deliberately pushing to involve this in budget. Involve economists, involve people to give you what and what can be done to integrate this into budget. Let us coordinate a legislative framework to make zoonotic disease and AMR control possible. We have established one coordinating platform. How far have they worked? The only one that we say has a legal back in West Africa is that of Senegal and that of Nigeria. Ghana is still working. War ECOWAS support for cross-border coordination on transboundary disease must be enhanced. National government must have adopted health systems response plan. They must also include the veterinary representation. Ongoing integration of One Health principle into national security and pandemic preparedness must be intentional. We must also try as much as possible to make the rural and the peri-urban population to be aware of the zoonotic risk by doing intentional research and bringing community engagement to their doorstep. We must also work with our livestock market and bush market. I asked the last time, can you have the wet bush market? Can you give me the map? They don't have. Mapping of livestock market, no. Movement of animals within that zone, hygienic practices that is being done in all these borders market, we don't know. But we know that diseases are coming in every day. If you see some of the studies we have done at the borders and see how animals are moving in without any restriction, you will know that we have a lot to do. Cultural practices and myths that influence disease perception must be properly studied and used as a tool, as an evidence to change the cultural belief of our people. Our risk communication for Ebola and COVID has stopped. Our deployment of animal health workers and volunteers for the awareness to hard to reach areas must be intentional. Radio and town hall, school-based educational programs on zoonosis and hygiene must continue unabated, and we must mitigate against misinformation. Not only with AI-assisted tools, but we must all be in the media, showing things that we are doing, collaborating with faith-based organizations, collaborating with those people like butchers, like market women, to bring in culturally sensitive messages. How? By what we do, co-creation of the message, co-implementation of the message, and co-sustainability of that message. So that in the process, they know the type of message they want, that their people want to hear. When we start to do this, the fragmentation of data, lack of cross-border cooperation, and duplicated effort that we have identified as a problem towards West African One Health platform will be solved. We must establish a regional digital platform for researchers and institutional practitioners. If I need somebody in my field, I just go to this database. I know where they are. I know their emails. Share data on zoonosis and environmental risk and policy brief. Support networking and funding collaboration. We must be intentional in this if we really want to do anything in West Africa. For us to strategically position ourselves, let's establish a One Health policy dialogue platform at national and ECOWAS level. Let's involve international organizations, WHO, FAO, in policy co-designing, so that funding will not be a problem. Let's intentionally promote South to South collaboration, more than South to North collaboration on AMR, surveillance and capacity building. Include researchers, policymakers. When you are writing grants, when policymakers are involved, they know that the outcome of that research must be implemented. Involve community leaders, involve youth in joint roundtable to make sure that this is working. We must also integrate veterinarians because they are now the list. So we need to intentionally involve them. Involve medical doctors, environmental scientists, sociologists, psychologists, everyone needed, either for behavioral change, for ecosystem change, for pollution change, for surveillance, because our collective efforts will lead to our collective impact. We need everyone on board. This is a group that are struggling because as they are pushing forward, some people are pushing back. But the other group, they are moving because they have no struggle. They work together. They must be intentional to make a change. Get rid of the wrong people in your group. Learn how to precisely differentiate between productive and destructive people. It helps your team get more safe, stable, and productive. And you will be able to move and achieve. No struggle will be there. And you'll be able to change situation. In conclusion, therefore, ladies and gentlemen, it is clear West African health challenges are deeply interconnected. For us to make a transformative research, we must not only be interdisciplinary, we must be culturally grounded for acceptability and ecologically informed. One Health is not just a concept, it is a call for collective action. Thank you. Thank you so much, ma'am.
Wow. Thank you very much, Professor Emikpe. I mean, it's been a wonderful time, and the lecture is highly illuminating and really speaking to what is currently going on. This is a great one. I mean, there's a lot of accolades on the charts for you. And well, maybe I should say we shouldn't expect anything less, because we've seen all the work, we've heard about what you have done. And for those of us in UI, we've heard a lot about you too. So we are very proud of you, and this lecture is very topical. So Dr. Bakari, would you take the question and answer session? Or is Professor Akinyemi with us? Hello? Okay. Mr.
Hello, ma'am.
Yes. Are you taking the question and answer session?
I can take it if you are not free to take it, ma'am.
No, go on. I'm
All
with
right.
you. Just go on. Thank you very much once again, Professor Emikpe.
Thank you, Prof, for this fantastic presentation. Prof, let me start first before calling from the public, I mean the audience, to bring in their own opinions and all that. I want to ask, what do you think is responsible for this problem of One Health as we face in Nigeria here? It's like everyone is just doing its own. Veterinary profession is doing its own separately. Human medicine is also doing its own separately. And we are all working in the same environment to ensure that we control disease. What do you think is responsible for this big challenge? I don't want to say little challenge, as it is. Thank you.
Thank you, Professor Dr. Bakari. Let me say this clearly. We have a problem of ego, and people want to lead. And one of the problems we have not yet understood is leadership is not about what you read, it's innate. And for you to be a leader, you must be looking at solving a problem. A leader does not look at what he wants to benefit, is to solve a problem. And we prefer to work on silos because you feel you don't want to move out of your space. Let me tell you, I'm a pathologist. Pathology, toxicological pathology, I've done so well. I got my PhD in veterinary pathology, not aquaculture, as you have read. And I delve into aquaculture, delve into other areas. Don't be afraid to leave your area. You might even do better in other areas than where you got your PhD. I found out that I got my space more in One Health by not being afraid to move into other areas. Currently, I do a lot of things in medical geography, doing a lot of mapping and all that to solve problems. When you are a leader, you are not afraid. And you are not afraid to work with other people because it's a collective effort. Anyone can lead. We learn to be submissive. The moment you think you are the one that has the monopoly of knowledge, we will not be able to leave our silos. And honestly, if we don't leave our silos, the problem will continue in West Africa. We need to move out of our comfortable zones, move into challenge our intellect, and we start to make giant strides. Thank you, sir.
Thank you very much, Prof. Please, to the audience, if you have any question to ask the guest lecturer, can you please indicate by raising up your hand?
I see
so that we can call you.
Victus.
I saw it before.
Victus from DEFRA was raising his hand.
Victus Sabute, do you have a question? Please indicate.
Yes, yes, I do. Prof, thank you so much for such a...
Can you ask your question, please, Victus?
Right, so the question is, in the face of dwindling development assistance...
please, raise your voice, please.
Please, is it better now? Can you hear me? I'm on full speaker.
Yeah, I think somebody is disturbing. Can we mute if we are not talking?
Go.
Okay, please, is it better? Can I proceed?
Just proceed. I can hear you.
Great. So in the face of this uncertainty around development aid or development assistance, where do you think One Health implementation will see itself, knowing very well that majority of One Health implementation is supported by development aid and assistance, and that is dwindling over the period? Do you see One Health seeing the light of day in relation to what you've shared with us? Thank you so much, and well done, Prof.
Yeah. Victus, this is the reality of what is happening now. And I want people to know that's why we are talking about prioritization and also cost effectiveness in research. Cost effectiveness. What are those things you need to do that will have a lot of impact and will not be too costly? Because if it is too costly, the local government will not be able to support. And this is where we are thinking of predictive modeling, where you just sit down, collect data that has been there for over 20, 30 years, and you'll be able to use it to solve problems. So we must be talking about cost effectiveness in research, cost effectiveness in data provision, cost effectiveness in policy implementation, and cost effectiveness in health research. If we can bring this to bear, that even the little money we are making impact, we can use that to attract people, because when you say assistance is dwindling, when they see results, they will not shy away from it. Thank you. Professor Aneto and Professor Aneto, please. And Professor Adimowo, please.
Good afternoon.
Yes, sir.
Congratulations, Professor Emikpe. Nice to hear from you again.
It's nice hearing from you, sir.
Yes, thank you very much. I listened to your lecture and I thought that what is probably needed now is a kind of a synthesis of some of the points you have raised. Yes. And in my mind, I thought that the West African Health Organization and maybe working with the Veterinary Council of Nigeria may be able to come up with policies, integrative measures to ensure that One Health is made central and can be related into many of the curricula that exist in many of the health professions, including veterinary medicine in West Africa. What is your opinion about this? Thank you.
I start from my area, and we are having a long talk and collaboration with universities and with veterinary school. I currently have a memorandum of understanding with University of Leone and with the École Veterinary in Senegal, where we are thinking of bringing students in to come to Ghana, to come to Nigeria, to work with veterinary school, students that can only speak French, so that the course of it, they learn how to speak English, they learn the ways of our veterinary practice in those countries, and we also send students to them to bring in the Francophone-Anglophone relationship. And we are also working with the Veterinary Council of Ghana, Veterinary Council of Nigeria, and other councils in West Africa to push this agenda. I believe strongly that very soon in the course of it, we'll be having a conference and having a policy dialogue where we bring the who is who into play in some of these contests. There is a grant we're applying for, which has to do with what we call equine-assisted therapy. We are bringing in the MP to be involved, not just writing the grant. We are bringing MP policymakers to be part of us. so that when we are able to win, it will be one of the drivers of these tools. So it's not just to contact people, it's to bring the active player to bear, to come to work together. If we start small and we are getting enlarged bigger and people can see our impact, a lot will join us in that crusade.
Well, thank you very much. That's right, but I just thought that that's like a piecemeal approach. If we had a central regulatory body, I'm happy to hear that you're already working with the Veterinary Council of Nigeria and that of Ghana. But I also think that the West African Health Organization, if it comes into the picture, might facilitate things and things might move smoother.
Sir, this is just, like I said, it is for discussion and for us to come together. And I think I've also talked to Professor Ikeolu and Professor Ajayi that we are really going to take it up, not just for this presentation, but to see that we go into implementation, working together with all the identified groups, and also to bring in consortiums that will really drive this, that also involve policymakers to make sure that one health West African dialogue is in place. And we can use this platform to apply for grants and help to bring in more researchers and to start a mentorship program in the course of this work. I know that the sky is just the beginning. We have quite a lot, but it's just to set up the tone for us to work and make sure that we achieve this in the next 5 years. Thank you, sir.
Well, thank you. I think the conversation has started, and that's a significant step forward. Congratulations once again. Thank you.
Professor Ademowo wants to ask a question, please. Egban? Hello, sir. Professor Ademowo.
Yes. Hello. Yeah.
Yes.
Thank you very much for your brilliant presentation, and I do not expect less from you. The area you've spoken about, this issue of One Health, is a major area of focus now all over the world, and is becoming very, very attractive. And like you rightly said, One Health seems to have been practiced in Africa more than in any other place, and the impact is so much in Africa. Unfortunately, it is the negative part that has impacted us the more, because it has only helped us to spread a lot of diseases, and with a lot of people not even understanding what is happening within their own environment. So, and a lot of these things are caused because of problem of lack of data, lack of planning, as you have said, poor collaboration. And I also think that the problem of lack of local funding, because all this, most of the funding that we have for One Health actually comes from the West or elsewhere, and they dictate what you have to do in a way. So if we're able to actually face the problem the way you have said it, because a lot of, how do we face the issue of our culture? People eating rabies meat and all kind of things like that. This does not happen in the West, and so it will be difficult for them to even give you money to go and do research into such behaviors that are not, that one cannot think about. So we really need this local support. And then one thing again that I say about this issue of collaboration, what is actually going on, the problem that we have is that it is difficult sometimes to even travel within the West African sub-region. It may be easier for you to go to Europe and back than to go to somewhere in West Africa. So all these are limiting our interaction. So one of the questions I want to ask is that, what do you think we can do about that? How can we go around it? And then one other thing again is that we have problem with implementation of research findings by our policymakers. So most researchers, even when you do the research, you tend to just write your report. Other people are implementing it somewhere. But in our own countries in Africa, the implementation is very, very low. So what do you think we can do to solve that problem as well? Then, lastly, I want to say that how do we create awareness of one's health among the people, the common man on the street? Everybody needs to know. Even our policymaker, they also need to know. But let me give you my own experience. We have a project that is going on One Health now. As you have rightly said, when we were writing the proposal, the Minister for Health was part of the proposal writing from the beginning, where the minister had a representative, through his representative. But I must say that at the point when I had to meet with policymakers, it was tug of war. It was not easy at all. So you see, so there is that gap between the town and the gown. And I know that when I was in Ghana not too long ago, one of the reservations that was also pointed out there was also that gap between the policymakers and the researchers. So what can we do about all this? Thank you very much.
Thank you so much, sir. And I think the first thing for us to do is what we are doing now, creating awareness, let everybody know that we have a problem and we can solve it together. Number two is the co-creation. We have not yet understand these three: co-creation, co-implementation, and co-sustainability. I've said it before, even though you involve the minister, we involve the minister in a manner in which we use it to boost his ego. Let me put it this way. That's the mentality of the politician. We have a very strong team that is media team. That is one of the things that has helped me in KNUST. We have a very strong team, TikTok, Instagram, name it, that, leading everywhere, pushing what we have done. And once a minister see that his name is being gingered along this path, believe me sincerely, you want to see me, it will be very easy. Because their emphasis is that people should know me with what is good. I'm the one pushing this. I'm the one funding this. I'm the one supporting this. It was through me they are able to get this money. This is one of the things that our policymakers like. And when you make the media presence to be heavy in an event, a top hotel, I tell you we're there, because he knows that all the media station will broadcast what he has said, and that is part of the team that brings. So the principle of co-creation, co-implementation, and co-sustainability is a very, very important thing in this. And in terms of the people, look, there is a way it is being done here where we push that the Earth Science student of the College of Earth Sciences should go all out every year, at least to 2 or 3 districts, to propagate One Health. And in these, they have a team, veterinary student, nursing student, medical student, and all that. They go to do a kind of community entry and making sure that they spread the news of One Health. We also have a program, Masters in One Health, where before you graduate, you must be able to do a kind of community entry and do a community engagement before you are awarded the degree. This is very important to bring the town to bring the gown to town. If we incorporate it into our curriculum, take, for example, all the medical schools in Nigeria has adopted a district. as a place, just like we have the Erua, a lot of changes will have happened. So there must be intentional move in making these villagers to be part of the things we are doing, and it make it easier. Sir, they are not gullible. They are very sensible. Once they are made to be important, they will make sure that the project succeed. I've also seen a question here: how do we make native intelligence into One Health, which could make our contribution to be global, to be unique? Look, one of the things that make Korea, China, Malaysia, is that they first promote what they have. My question always is, what do West Africa have? What do we have to showcase to the world? Even language we don't have. French is borrowed. English is borrowed. Until we start to look inward, I have seen the fastest growing economy being an economy where they propagate what they have. And it is until when we sit down with this, we will be able to achieve the best of the success that God has given us. If it is traditional, let's promote what we have. No discrimination, nothing. West Africa is West Africa. We are going to propagate. If they are not buying for us, we will buy from each other to push to the world that we have something to sell. And this should be our way of approach. With the dwindling economic situation, we need to help ourselves, not to fight ourselves, not to have a racial or ethnic fighting. It is not necessary. No Anglo and Franco fighting. This is the time for us to work together to solve the problem of West Africa.
Thank you, Prof. If you have any question to ask from the lecturer, you can just indicate your hand, or you script it down in form of message. You will read it and you will definitely answer it. Thank you very much. Okay, there's somebody already raising his or her hand.
Yeah, my hand is up, please, Dr. Bakar.
Okay, yeah, please. Okay, ma, you are free, ma.
Yeah, thank you once more, Professor Emikpe. I'm so happy you mentioned issues of training and mentoring young leaders, young researchers. Actually, this has been the theme of IAMRAT's day, which was held early this month in June. And we're still looking into how to get this into a structured program for our young researchers, medical students, master's students, PhD students. So this is again another important need, and helping us to emphasize the need for that program. Thank you very much again for bringing this up, because we need to prepare them for global health. You mentioned the issue of mining in Nigeria, and I think so many of us responded by saying, in Ghana, and many of us responded by saying, we thought it was only in Nigeria. So the issue of West Africa coming together and really fighting this menace is very important. It's not just taking the natural resources away, but as you have said, contamination of water, of soil, which eventually gets to human and animals, causing diseases. This is very important, and I hope the government would really take up this task. I know it's been very difficult because of corruption and so on, but I hope West Africa coming together, they should be able to fight these intruders and get things done properly. We are not saying they shouldn't mine, but at least let it be done in a way that is safe. and providing health security for our own people. Just today, there was something on another platform talking about how meat is being processed and the implication for health of the people. People were talking about using tires to burn the skin of animals, and some saying formalin is being used to wash animals after killing them. So I think in all of this, we should also think of bringing in the food technology people into how, at the end of the day, the animal is also safe, even after killing for eating and so on. So our team should also consider including those in food tech. And as you have said, native intelligence and also training butchers and all those involved in using animals in preparing food. I think it's something that you can just briefly. Thank you very much.
It's a very big challenge, especially when you have to take to have an ethical approval for a work that involves both human and animals, and they want a separate ethical approval for that of humans, ethical approval for that of the animals. And there have been a lot of advocacy that why don't we just have one that look at One Health as holistically and give an ethical approval that will be able to take care of whatever research or whatever work we want to do in One Health. This has really been a challenge because in many institutions, ethics is a big thing and is a money-generating venture. I didn't want to go into that, but submitting that or merging together with animal had been a very difficult thing because of the setup. But I'm very sure that like Noguchi, like KCCR, like IAMRAT, this should be something that can be taken up and there won't be any problem. First, because it is a research institution that is One Health driven. Once it is One Health driven, we'll just make sure that the ethical committee involves all these arrays of experts to look at whatever is done holistically. And we must also think of the connection with international agencies, which will help so that when they know that the ethics committee of IAMRAT has looked at it, it can be trusted. And these depend on the quality and the certification and the connection of our committees to some of these international agencies. I think if we are able to put up this strategically, we'll be able to solve the problem.
Thank you very much, Prof.
There's a question. There's a question already posted there. So I would like to ask about the relationship and take of veterinary health in One Health advocacy.
I think
have you seen it?
Yes, our president, the overall head of German West African Center is actually a professor of planetary health. And he's looking not just the area of humans, but he's looking at both environmental and human and animal space. Planetary health is actually a new definition that encompasses One Health in its sense, is bringing into beer more of the environmental force and looking at the whole world as one. But this is gaining ground more, and there was even a kind of move to kill One Health, that One Health is not the best to be used. They tried that in Geneva and they failed because it was very clear that One Health is the way to go. But planetary health is looking more at environment, and looking at the health of the environment has a lot to do with the health of those that live in it. This aspect is really very important and is really gaining ground, not only in the European countries, but also in Africa. Even in the area of food. In fact, there is now what we call One Food, which is actually advocating for One Health in food system. And that tells you that One Health is really gaining a lot of ground, even in food system. And some are even using plant, bee, honey, as an epitome of One Health advocacy. Honey as the animal, bee as the animal, what they eat as the plant, and what they produce honey for the human. So there are quite a lot that is coming up now, the concept that is giving One Health a kind of push for everyone to understand the need for us to think holistically, not in a silo. Professor Dr. Bakari, I hope I've answered it.
Yeah, correctly, sir.
Thank you.
Any other question, please, from the audience? I can see our elders present on this platform. If they have one or two contributions to make, please. Our former provost.
Yeah, I saw him.
Please, sir, do you have any comments?
He was with us, so he had to have a comment.
Okay.
Prof.
Okay, sir. Prof, can you make some comments, sir?
Well, thank you very much for this opportunity. Professor Emikpe, congratulations on a well-delivered talk.
Thank you so much, sir.
I think the issue of One Health is something that should interest all of us because we are all tied together with all the other inhabitants of this planet. And the way you have brought it out to the fore, I think it's so good. It's something we need to continue to advocate for very forcefully. And I look forward to working with you and others to make this a reality. Thank you very much for enlightening us.
Thank you, sir. Thank you, Prof. I see
Thank you, sir, Prof.
My team head, the head of Africa One here, Professor Bonfo. I think he might want to say one or two things. Professor Bonfo, Bashiru Bonfo. I think I saw him online.
Yeah, Benjamin, thank you very much. I joined late, so I knew what you are going to say. Greeting from Côte d'Ivoire, I'm Bashiru Bonfo, the director of Africa One, engaged in the capacity building One Health in Africa, where Benjamin is the chair of the Scientific Advisory Board. No, I quite agree with you. And what I just want to add, as you mentioned, is that for One Health, we definitely need to think holistically, but think on complex issues that cannot be handled by a single discipline or a single sector. And these collaborations should definitely lead to an added value. So this is something which is very important. We have missed that in many of our training program, our curricula, and this is now the time to train the next generation in how to make coordination, how to work together, and how to bring different type of knowledge, be it scientific knowledge or non-academic knowledge together in order to develop a solution that can handle complex problems. Thank you very much.
Yes, sir. Thank you, Professor Bonfo.
Thank you, sir.
I also saw Ladapo Okari. Okari, I thought you were going to say something.
Sorry, I was driving, listening to you. Very interesting. Very, very interesting. I was not expecting anything less. We'll be working together. I think there are a lot of new things you brought into for, and then the need, the emphasis you put on the need for networking, effective networking, just not just networking, effective one. I think this is just the beginning. The planet health that was recently been advocated is just, will I call it an extension of the One Health 2, or the One Health is just a component of it. But whatever happens, I think inter-collaboration, working together with objective that we can achieve this, I think it's one of those things we should focus on. There's something about the environment, the environmental media you talked about, which is very important, about mining and your interest in the medical geology. It's very interesting. There is a kind of interrelationship. The fact that you also linked it with food, why the need for us to have people in the food, science, and technology area to also be part of it. I think this identification of the important people like the new advocacy now, or the advocacy that is ongoing, where we talk about moving from STEM to STEAM, I think it's part of what we should actually be talking, laying emphasis on. The policymakers, like you said, most of the involvements are cosmetics. And so if you strategy not to go back, like that communication route that you suggested, and then trying to avoid the political coloration, I think it will help too, because countries differ from country. You cannot compare Nigeria, for instance, with Cote d'Ivoire. Their own policy and then compliance or implementation may be strictly that which has been that's a political tone, but giving technocrats the place to contribute immensely. In this place, where even the government in Nigeria, the government have to identify their consultants. Even in a project, one health project, they still have government consultants. I think that is a kind of, I call it an aberration or a confounder that we must eliminate. So, in all, Professor Emikpe, must congratulate you. This is wonderful, and I hope this material will be given out with the IAMRAT. And I hope mine will be coming soon through this place too, because you linked me up quickly, especially when we begin to talk about intellectual property and your advocacy on traditional knowledge. I think those are areas too keen, and we need to explore those areas. Thank you so much, Director of IAMRAT. Thank you, elders that are in the house. Thank you, Dr. Bakari. And above all, my brother, Professor Emikpe.
Thank you.
Thank you. We'll see you soon.
I think I also saw Sylvester Segbaya. Sylvester Segbaya is the one heading breakthrough action on rabies in Ghana. Sylvester Segbaya.
Yeah, Prof. Thank you very much. Just a quick word to say a big congratulations to you for how very beautifully you have presented this topic. And you highlighted a lot of things about what we have, our traditional medicine, and the way we should move forward with it. That's one collaboration that I believe we should strengthen going forward. And most of the work I have done has been in risk communication regarding zoonotic diseases. I believe that, and that's a major discussion point everywhere, because if we are going to have communities change their behavior, people must be aware of the risks associated with whatever we do regarding the environment, human and animal health. So thank you for bringing those to the fore. I believe that we should not necessarily wait for donors. We should harness the little available resources we have and see how best we can consistently and continuously engage our communities to make them aware. And behavior change takes time, but once we start and we remain consistent, that's going to bring a lot of transformation. So let me once again congratulate you for a very beautiful presentation, and thank you very much.
I think I also see Gilbert Foucault. Gilbert is also here. He's from Africa One. Gilbert.
Yes, Prof. Thank you very much. Thank you very much for this inspiring and powerful presentation. Yes, when I was listening to you, I was like inspired by new research idea, because you touched the area of indigenous knowledge. As an anthropologist, this is my area, and I think there is a potential for us to contribute there, because I've always been thinking, as you said in your speech, I mean, sometimes in our countries, in our West African countries, the diseases we tackle sometimes are prioritized by external actors. And sometimes when we come to One Health, most of the time we have like a top-down approach, where we have like a national platform that have been organized in various countries. And sometimes I wonder if those platforms are put in place just because it is One Health concept, it is a buzzword, or actually there is really a need. And even when there is a need, how does it cascade down to the local communities? How is it? Do they make in such a way that people and the local community can feel that now we are practicing One Health? And for me, I'm reflecting in a way that we can organize a sort of a reverse, a bottom-up approach of One Health. How do communities feel the One Health concept? Because we are interacting with the environment, with our animals, with our communities. So for us, it is time to design a sort of One Health concept that is bottom-up One Health. Thank you very much, Prof.
Thank you very much, Prof.
I'm just looking people
I'm seeing I'm seeing Professor Odole from physiotherapy there.
Yes.
Prof, you want to say something?
Let me say something before Odole will speak. When I had accident in 2006, Odole was my physiotherapist, who actually nurtured me to be able to walk again. So it's nice having you here, ma.
Thank you very much, Professor Emikpe. Good afternoon, everyone, or good evening. I'm so excited to be part of today's meeting. And the concept of One Health, especially as it relates to climate change, is actually very interesting to me. I've been an advocate for climate change as it intersects between health and disability. So this is a good one. We should not work in silos. So I think this is a very good start for everyone here in different disciplines and professions to know that we've got what it takes to lead and solve Africa's problems. Thank you, Professor Emikpe. So good to hear your voice and see you after a long while, though virtually. Please, we need to keep in touch. Thank you, everyone. Thank you.
Thank you, ma. Thank you, ma, Prof. So I now hand over to the Okay.
Professor Aditich is also here from US, I think.
Hello.
Professor, yes, Professor Aditich.
Yeah. Good afternoon. I'm happy to be part of this great presentation to listen to my good friend, my brother, Professor Emikpe. I of the opinion that as scientists, as medical people, we should work together. Though I joined late because I was attending another meeting, I wouldn't know, maybe you touch on the part of aquaculture.
I did.
Yes, that's very important. It's part of the environment. Our food comes from what we eat, comes from the water. So if you can work as a team in this part of the world, nobody will be able to stop us and will be best for it. Thank you for the great presentation. Over.
Thank you, sir. I think I want to, at this junction, hand over to the Director of Institute, Professor Ikeoluwapo Ajayi, to do the vote of thanks. Hello, ma. Are you there?
Yes, I am.
Yes, ma'am.
Okay. Thank you very much, Dr. Bakare, for handling the Q&A session. But I think there's something from Adebayo Ismail here. I'm trying to read it, but it's not coming. As it is known that there... can somebody see that? Dr. Bakare. Dr. Bakare, please see the before.
Yes, can I read it on your behalf so that
please,
I can see it? Okay. And as it is known that there were always differences and inferiority with superiority issues in any advocacy organization involving committee of different members and multidisciplines. In these regards, I would like to ask about the managerial approaches to sustain this advocacy of One Health. Thank you, sir.
And then the other one, please, from William.
Okay, William Tasema.
Yes.
Taseme. To what extent can we say there is going to be a regional collaboration within West Africa to manage diseases? For example, dog slaughter and consumption does not occur internally alone, but dogs are transported from Cameroon, Niger into Nigeria. Some of these harbor the disease. The addition of these dogs worsens the rabies situation in Nigeria. Again, dogs enter into Ghana from Burkina Faso. Dogs are purchased in Ghana and moved to Togo for consumption. The 2030 elimination period does not appear to be feasible if we continue to work in silos. Finally, can you tell us about the abortive human rabies in Nigeria, since we have not detected that in Ghana as yet? Thank you.
Thank you very much, Prof. So, Dr. Mbakwe, briefly help us address this, and then we round up. Thank you all for still being around with us. We appreciate you. Thank you.
Let me say this in terms of managerial issues, especially in One Health. We face that challenge here. Sometimes when a vet is leading, the medical doctors will not want to be part of it. When an environmental science is leading, but I think this complex has to drop because our people will suffer if we don't do what we're supposed to do. So there is a need for us to work together and not in silos. Number two, in terms of the animals that are entering from this is a very interesting area to research on, especially in terms of market strategies. I have looked at market movements in certain animals that has to do with like avian influenza, but this flow of this market and the mapping of it can help in what we call disease trace back and trace forward. And this is actually telling us that rabies move from one country to the other. So the migration pattern through the market needed to be mapped so that we'll be able to know how best to be able to solve this problem and to know the type of rabies virus that is migrating throughout the whole West Africa and their pattern. So this will need us to possibly interact together and work on this. I have few students working on rabies, looking at dog consumption in Buea. We are comparing it with that of Botatanga, and we are also looking at it in terms of Cross River in Nigeria to see some inflow and how this can influence rabies. Dr. Tessiam is one of my younger ones here who is really working very hard on rabies, and I'm very sure that this is an area where we can really move and talk about rabies being a transboundary disease. So this is a big, very big issue, which is a concept that we know nothing about. Over.
Okay, thank you very much, everyone. I think you will agree with me that the last 2 hours have been a very worthwhile time, and we've learned so much. Professor Emikpe has actually stimulated us to think deep out of the box and see how we can do more research in One Health and also advocacy. I think the IAMRAT, which I have also discussed with him, is very, very keen on working with the One Health team. And Professor Emikpe also has promised to work with us. And so we look forward to this. The IAMRAT is actually very, very keen and important for collaboration both locally and in the West African and African region. So this can really be a very good start off for us at IAMRAT. And I'm sure you work with some of us. So we want now to have a structured program for IAMRAT to really move research in One Health, and not only research and training in One Health. Before I round up finally, some of our elders have been have been acknowledged. So I just want to thank all our past provosts, past directors of IAMRAT that were able to join. And we're very grateful. You've always been supportive. Professor Migbanu, you're acknowledged once more, and thanks for your contribution. I can see that Professor Emikpe's team has been well represented on this. This is one IAMRAT lecture that I could see the lecturer moving all the his network to be with us on this lecture. And they have not only come, but they have also contributed. We are very grateful to the Ghana team, those from Cote d'Ivoire, the Africa one, and others globally, US and so on, that have joined this lecture. You have really enriched our knowledge of this One Health. And for our past IAMRAT lecturers, I have Professor Neto and others that joined. Thank you very much for always being with us, not leaving IAMRAT, but contributing to the success we have got over the year. And then we also have our ICOMA, represented by Professor Asinobi. That ICOMA is the College of Medicine Alumni Association. So thank you so much. You've always been with us. If it's not you, Professor Tolori, and we are very grateful. And we also have Provost of the Buea University College of Medicine, in person of Professor Deleke. I don't know if he's still with us. We appreciate you. All our fellowship graduates, Professor Emikpe mentioned the fellowship program. We thank God that the University of Ibadan was a pioneer to running that program. And it has really helped Nigeria a lot in terms of field epidemiology and laboratory training program for outbreak diseases, surveillance, and so on. So we still have residents. So this is a good move. And that's where I first got the gist about One Health. during these programs. So I want to thank everyone for coming, all our residents, all our students, all our doctors, professors. You are well recognized. Just know that we recognize you, and for time's sake, we will not be able to mention names all through, but you are all recognized. And we hope to see you again next month for another interesting lecture. So be on the lookout the last Wednesday of the month at 3 p.m. Nigerian time. Please, you are all welcome. And not only that, we would also expect that all you learn from these lectures, please translate it into action, and you can come to us for collaboration or even advise the IAMRAT as to how we can move forward in some of these areas based on your own expertise. So I thank you all, and I say have a lovely evening. Professor Emikpe, we cannot thank you enough. And we look forward to the meetings that will help us to move on. It's not just this lecture, we have to do something to ensure that we actualize all that you have suggested. And Professor Lugasa was with us. I tried to see if he's still with us. I want to thank him very much for making this to happen. Just as Professor Emikpe mentioned, it was Professor Lugasa that linked me up with Professor Emikpe, and definitely it's been a very good link, a great link actually, and also Dr. Awusonya, all of the veterinary public health faculty of UI. I thank you, and I thank you all for coming. So have a good evening, and bye-bye. Say us well to all your teams, wherever they are. Thank you. Thank you.
Thank you. Thank you, ma.
Have a good evening.
Appreciate you, ma.
Yes.
Bye.
Thank you, Prof.
Thank you. Professor Kare, you are one of us. So
thank you.
To give your lecture. Professor Asilobi, thank you.
Ike, thank you very much.
Eshema, thank you.
That was fantastic.
We thank
well
you.
Done. Well done.
Thank you, ma'am.
Well done.
Please register if you have not registered. Please register using the link that I provided. I'm going to put it again for those who are still with us. Please register, and you can get your CME certificate. For the team in IAMRAT, don't say I may be late. Dr. Bakare, Dr. Adeniji, Prof. Ademowo, and all those from IAMRAT, I think we should congratulate ourselves for this successful outing. Thank you so much for your cooperation, and have a good day. Bye-bye.
Bye, everyone. Thank you.